Welcome back. Now we are going to start learning about the lymphatic system by learning about its functions and structure. So let's start with the four functions of the lymphatic system. The first one is it absorbs extra tissue fluid and returns it back to the bloodstream. So every day, about 30 liters of fluid leak from the bloodstream into the tissue, and about 90% is returned directly back to the blood, which leaves about 10% in your tissues. And that other 10% is returned via the lymphatic systems. If that doesn't happen, you will end up with swelling. If it's in an appendage, an upper extremity or lower extremity, we call it lymphedema. You also can have lymphedema in your trunk. It won't be nearly as noticeable as if you have it in your feet or in your arms. The second function is in your small intestine. There are little tiny capillaries known as lacteals where fats are going to be absorbed, because remember, fats and water don't get along, so fats are not absorbed into the bloodstream. So they have to be absorbed into the lymphatic system, and then they're going to be transported and attached to proteins, and then finally dumped back into your bloodstream. The third function is the lymphatic system is where your lymphocytes are made. It's where they are stored until they're called to duty, and then they're going to be distributed and do their work. And your lymphatic system also is responsible for your immunity. Along with your lymphocyte, it has other cells that help you defend against pathogen. And there's other processes besides just your cells to defend against pathogen. We'll learn more about these shortly. So that brings up the question, well, what is lymph? And to understand what lymph is, we have to go back to blood. Okay, so in blood, remember, blood was about 55% a liquid component, and the plasma, the watery stuff, remember, is 90% watery, the plasma is going to leave the blood and enter the spaces of your tissue. It's not going to go into the cells. It's going to go between the cells. So it's going to stay extracellular or intercellular between the cells. And if we look at it closer up here, you can see this blue area. Here's where all that fluid is. And we call this fluid, when it's in your tissues, we no longer call it plasma. The word plasma is only used when it's in the blood. Once it's in the tissues, we call it interstitial fluid. Then what's going to happen if it's not reabsorbed and becomes plasma back in the bloodstream again, the 10% that's not reabsorbed there will then enter into lymphatic capillaries. And if it's inside a lymphatic structure, it's going to be called lymph. Okay, so let's look at the travel of lymph. So when we look, we have a regular blood vessel capillary bed here with an arterial on one side and a venule on the other side, and the capillary bed where gas exchanged, and then tucked up among it, we have lymphatic capillaries. And they all have blind ends with little protein filaments which anchor them in place. So they're tucked and stuck among regular blood capillaries. And if we look at the structure of lymph capillaries, they're different than blood capillaries in that they're single cells, but they're kind of like shingles in that they're overlapped. So when the pressure outside the capillary increases because there's extra fluid, it's going to push the little flap open so that the fluid, the interstitial fluid, can enter inside the lymphatic capillary. Now, once the fluid is inside the capillary, it's only going to travel in one direction because there are valves which are going to prevent backflow. So what's going to happen is when muscles contract, it pushes it up in one direction when the muscle relaxes. And if the lymph would try to come back down the other direction, that would cause the valve to close, so it could not go any further down. All right. So after the lymphatic capillaries, these are going to merge together to form lymph vessels. And so we've got lymph vessels all throughout our body. They also contain valves for one-way flow. And everywhere the lymph movement is going to depend on the skeletal muscle contraction. So that's very easy to understand in your extremities, and in your trunk, it has to do with the skeletal muscles that are contracting for when you're breathing. And that's causing pressure changes in your thorax and your abdomen. And that's how the lymph is moving in those areas. And that's going to bring lymphs either into lymph nodes or into larger structures known as lymph ducts, which are the final tubular structures that are going to drain lymph and return them back into the bloodstream way up here, the upper part of your chest, right under your clavicle, right under your collarbone, and what's called the subclavian veins. Okay, so you don't have to remember the subclavian veins because it's not bolded, but you need to know the lymph ducts are way up here on your collarbone. So it's like the last blood vessels, because the heart would be right here where these two blood vessels are cut off. That's where the heart would sit, between those two blood vessels. All right. So that brings us to lymphatic sites. And so when we're talking about lymphatic sites, we have primary sites and secondary sites. So primary sites are where lymphocytes are made, where they go to school, where they grow up, where they mature. Once they've graduated, they move to a secondary site. So this is where they're going to get stored and or where they're going to work, because oftentimes we store them where we think we're going to need them. So you don't have to wait for them to travel there. Okay. So there's only two primary sites, the red bone marrow and the thymus, and there are a lot of secondary sites. Spleen, there's only one. Lymph nodes, there's a bunch throughout your body. And then there's a lot of organs that contain what we call lymphoid tissues. In other words, tissues that have aggregates of lymphocytes. Okay, so the first primary organ is your red bone marrow. And this is a diagram of where you have red bone marrow in an adult. Okay, so only in a few of our bones when we are an adult. So the easiest places to access red bone marrow in an adult would be here, your breastbone, your sternum, and then like here at your hips, the top of your hip bones. And we could put a needle in there and then aspirate and look to see all the cells being made in your red bone marrow. Because remember, red bone marrow is where hematopoiesis occurs, formation of all of your blood cells. So not just some of your lymphocytes, but all of your red blood cells. But specifically, both your B cell and T cell precursors. So we have a stem cell for your lymphocytes that is made here, but only the line that forms the B cells matures here. So what you need to remember about red bone marrow is this is where B cells are made. So bone marrow with a B, specifically red bone marrow, is where B cells are made. The other primary organ is the thymus. You may not have heard of it. Do not confuse it with the thyroid gland in your neck. The thymus is in your upper chest. It sits at the upper part of your heart, behind your breastbone, and in front of your windpipe. So between your trachea and your sternum. Okay. And what happens is, you remember those stem cells I talked about in the red bone marrow? We had a stem cell that would make your B cells. Well, that stem cell moves to your thymus, and in your thymus, because your thymus makes some hormones we don't need to learn the names of, it will make T cells. So thymus with a T is where your T cells are made. And red bone marrow with a B is where your B cells are made. Now, your thymus is quite large when you're a child, but when you hit puberty, it starts to involute. What does that mean? It means it turns into fatty tissue, and a little bit of this remains behind, but there are no more stem cells after puberty. So what happens is whatever mature T cells you have left over from that point on for the next 80, 90 years of your life, mitosis of those T cells is going to give you new T cells. Okay, so only 5% of the lymphocytes in your thymus will ever actually leave for defense. Okay, so don't worry that you're not ever going to have enough. And these are, as we'll learn later, are going to be critical for specific immune defenses. All right. Moving on to your secondary organs, right up here, tucked under your rib cage on the left upper part of your abdomen is your spleen. Has a very thin capsule and a very large tortuous blood vessel. So there's a big blood supply to it. And because of that thin capsule with a little bit of trauma, it can rupture, especially if you break an overlying rib. And you could bleed to death quite quickly from a ruptured spleen. This organ is your largest of your lymphatic organs, and it's about this big. And let me put it over here, about this big in a normal person. So smaller than your cell phone, but thicker than your cell phone, obviously. If we were to look at it under a microscope, you would see it would have areas that are darker. These are the areas that have a lot of immature white blood cells waiting to be called to duty. And then there are other areas that are paler. And if you looked at them closer, these are going to be areas that are going to be packed with red blood cells. And so it kind of divides it into stuff called white pulp and red pulp. So let's go to a cartoon drawing to understand this better. So here we have a little arterial bringing blood flow into it, and you can see it branches. And surrounding each little arteriole here, they have put white around it, because this white area surrounding it is called the white pulp. So what is white here is actually these dark circle areas, which represent what in other tissues we would call lymphoid nodules, but here they're called, because we're in the spleen, they're called splenic nodules. And so the white pulp, which surrounds the arteriole, this is a reservoir of lymphocytes just hanging around, waiting to see if they're going to be called to duty. Now, blood normally comes into the spleen, into the arteriole, and goes through capillary bed, and then it's going to go into the veins. Okay, so the spleen's a little bit different in that it doesn't have a normal capillary bed. It kind of opens up into this lakeish area, which is this whole pale pink area, which then is going to drain into these venous-y tortuous areas, which will eventually drain into the veins. So these tortuous venous areas are called venous sinuses, and the pink area is known as the red pulp, because this is where the blood has drained from the arteriole. It goes into the red pulp before it goes into the venous sinus. So the red pulp actually surrounds the venous sinus, and the whole point of the red pulp is we are going to be filtering your blood. So there are macrophages sitting here as well as your red blood cells. And so the macrophages are cruising around like Roomba vacuum cleaners, looking for any kind of debris that was brought in with the blood. Is there any bacteria in the blood we need to phagocytize? And then they're looking and they're going, oh, that red blood cell's kind of dinged up. It must be 119 days old. Time for me to break it down and eat it up. Okay. So when we say the lifespan of a red blood cell is 120 days and they're destroyed in the spleen, this is where this is happening in the red pulp, because the function of the red pulp is to filter the blood. All right. Another secondary site are your lymph nodes, and lymph nodes are found all along the pathways of those lymphatic vessels. Okay, so you can see lots of lymph nodes, and some are tinier and some are larger, and that's because we get big aggregates in our groins, in our armpits, in our neck. And when they get called to duty, they will enlarge. And once they've enlarged, they never quite shrink back down to their little tiny sizes. Okay. So here's kind of what a lymph node would look like in a drawing. And so lymph would come in, you would have a lot of lymph vessels draining into one lymph node. And so you can see that here. And then the lymph is going to get filtered into various compartments where it's going to be exposed to macrophages and lymphocytes. And so if there's debris in the lymph, macrophages can do phagocytosis and lymphocytes can mount a response if it's needed. And then the clean lymph will exit out the other end. And what you can notice by looking at this drawing is once lymph has left one lymph node, that same lymph tends to go to another lymph node and then another lymph node and then another lymph node. So it's kind of like it's straining it again and again and again and again and again to really make sure that lymph is cleaned long before it gets dumped back into the bloodstream. And that's why we have lots of lymph nodes in our groin area, in our armpit, in the back of our, around our spine, where it's draining our digestive system, in our throat and neck area where things can be entering through our nose and our mouth. So the function of a lymph node is not to filter blood, but to filter lymph. Okay, and by filtering lymph, I mean removing pathogens, removing debris. This is all going to be done by that same process, phagocytosis. So if you didn't learn that word already, because I know I've been talking about this for months already, please learn that word, phagocytosis. Also, it can attack cancer cells. So if you've ever known anybody who was diagnosed with cancer, they usually do a lymph node dissection to look to see if cancer is already in the lymph nodes, which is a good thing, bad thing, because if it's caught by the lymph nodes, that's good because it meant it couldn't go downstream. If it was caught by the lymph nodes, it means it wasn't dumped into the bloodstream where it could be carried anywhere in your body. But it also was a bad thing in that it meant it was draining from the original site of the cancer and got into the lymph nodes. And as I said before, if your lymph nodes are busy fighting an infection, you will have increased numbers of cells there and they will increase in size. And if it's an infection, they can get tender. If they're fighting cancer, yes, they also can get increased in size, but they will tend not. They won't be tender usually. Okay. Another secondary site will be lymphatic nodules, similar to those that we saw on the spleen, but in this case, they're going to be in your respiratory tract. So think your, nose and mouth, lungs, airways, your genital tract, and your digestive system. So looking at the digestive system first, here we can see up here's the surface. And so, you could have E. coli in that burger that you ate. You could have dropped a cookie and picked up some germs on the surface. And here's the thing. Usually they'll be killed by your acid in your stomach. But let's pretend they weren't, okay? You've got a bunch of lymphatic cells just sitting here waiting to be called to duty. You have so many, in fact, in your small intestine and your appendix that we actually call these very obvious errors. They're called Peyer's patches. You don't have to learn that name, but that's just what they're called in the small intestine and appendix. Okay. But actually, go ahead and learn that word because you also know the other word known as tonsils, which are just very large lymphatic nodules. Okay. And these are the first to encounter these antigens entering your body via your nose and your throat. And you're going, wait a minute, Dr. Powell, they're back here in the back of our mouth. So why are you saying entering your nose? And I'll show you why in a second. So here's what a tonsil looks like. Do you see those follicles in there? And they have a surface, but they actually also have these crypts. Can you see those little grooves? They got these microscopic crypts, so those little organisms can come down in here. And this is why they would get enlarged. But I bet you didn't know you have 3 sets of tonsils. So yes, you've got this set here on the backside of your mouth throat that you know about. But you also, if you went straight back in your nose, you have another set up here, which some people call the adenoids. And then you have a third set of tonsils in the back of your tongue. So if it ever feels like the back of your tongue gets swollen when you have a cold or a strep throat or any other kind of upper respiratory infection, it's because it does, because you have tonsils there trying to keep you healthy. All right, that's it for this section. So please come back and we are going to start learning about immunity next. So see you shortly.